When I was diagnosed with breast cancer, I was a lawyer. Information was what I wanted, and so I was grabbing for anything I could get a hold of.
As many of us may know, that's not unusual.
If you have a life-threatening illness and you see something in the newspaper that says to you, this may save my life, you're going to want it unless you really know what's going on.
Many people use the web to do their own research on disease or condition, and those things are very difficult to do if the content is sort of locked up. And everybody who's done this had the experience of seeing a message, access denied, $50 charge for seeing this article.
And often a treatment's been recommended to them, sometimes a relatively new treatment, and they want to know, well, has this been tested in my kind of cancer? What kind of results have we seen? Those are usually published, and if they're not published in an open access manner, then we can't get that information for the people who need to see it. It's that simple.
So what is open access?
Open access is really a change in the way that scientific information is being published.
The way the prevailing system of scientific publishing works, and has worked for 300 years or so, is that research is published in journals that are for-profit, and to cover their costs, they charge subscription fees, or with the advent of the internet, access fees for an individual article. So open access is a way to sort of remove barriers to access of various kinds, financial barriers, use barriers that prevent us from sort of moving forward in many ways. So the Public Library of Science, or PLoS, is a open access publisher. And PLoS publishes 7 journals on topics ranging from genetics to medicine to biology. And we publish about 500 articles a month, fully peer-reviewed. Many of our journals are in the top ranks of their fields after just several years in operation. And all of the content in all of our journals is in open access, which means it's immediately free and available to everyone. Our audience, our constituency, is primarily other scientists, because scientists use research papers to understand what's going on in their fields, to build upon that research. So much of it is fairly technical and complex. However, we write synopses of all of our articles that are generally understandable by the public.
It's a great gift for librarians to be able to point people in that direction and really help people understand what's going on in science and medicine.
It's a great gift to those trying to spread accurate cancer information too.
I do believe that health has become the issue of the 21st century. And I believe that as long as we as consumers think that PLoS, or open access, is just for doctors and scientists, we're missing the boat, because that information is about our health.